Hello, everyone. Thank you for everyone who's tuning in today. My name is Kevin Morrison. I'm the Cook County Commissioner. I represent the 15th District here in the northwest suburbs of Cook County. First and foremost, thank you to everyone who's tuning in and watching live. Thank you to those who will be watching this recorded. And most importantly, thank you to our three incredible panelists for joining us today on an incredibly important topic. Since taking office, ending homelessness and supporting those at risk of homelessness has been a top priority for me since I've heard from countless constituents about the challenges they face around housing insecurity and lack of affordable housing options in the northwest suburbs. I'm incredibly grateful for the three organizations here today who have educated me on these issues and have even gotten my office and myself involved in the annual point in time count to better understand those experiencing homelessness, especially here in the northwest suburbs. That experience has transformed me and how I want the county to be part of the solutions to end homelessness moving forward. COVID-19 and the economic impact has had devastating impacts on individuals and families, causing many to worry about their housing and their housing security. I look forward to hearing from some experts today on how this pandemic has affected their work and what resources they have to offer. It's definitely an incredibly important time that we help out those in our community, our neighbors, and help make sure that we are all stronger moving forward after dealing with the fiscal impacts that we're seeing today. I'm honored today to be joined by three incredible leaders who are leading the charge to help end homelessness here in Cook County. We've got today Katie Spoden from the Alliance to End Homelessness. We've got Beth Nabors from Journeys, The Road Home, and Sonia Ivanov from Northwest Compass Incorporated. I'm really happy to have you three here today. Without further ado, we're going to move on to our first of introductions. But for those of you watching live, I want you to know if you have any questions, concerns, comments, please leave that in the comment section of this live feed. We will see your comments come through and we'll be able to get to them as we get to our discussion portion of today's town hall. Again, thank you all for being here today. And without, we're going to start with Katie Spoden from the Alliance to End Homelessness. Katie, thank you so very much for being here with us today.
Great. Thank you so much for inviting us to be here. My name is Katie Spoden. I'm the Advocacy and Development Coordinator at the Alliance to End Homelessness in Suburban Cook County. The Alliance is the lead agency for the Cook County Continuum of Care, or COC is the abbreviation we use. As a COC, the Alliance is responsible for planning and coordination of homelessness services and housing options throughout Cook County outside the city of Chicago. So Cook County is massive. It includes 131 municipalities, 570 square miles, and is home to 2.5 million people. So across that area, as the COC, we bring together a range of services and housing for individuals and families who are experiencing homelessness. Looking at our 2019 data, on any given night, nearly 900 individuals are experiencing homelessness in Cook County. So this includes individuals staying in emergency shelters, transitional housing, and experiencing unsheltered homelessness on the street or in another place that's not meant for habitation, like a car or CTA or an abandoned building. So last year, across this entire area, close to 9,000 people received homelessness-related services. That's 9,000 people who received services. Approximately 2/3 of these people were people of color, 9% were veterans, and 12% were experiencing chronic homelessness, which means that they have been experiencing homelessness for over a year and have a documented disability. So across suburban Cook County, especially now as we look at the needs for emergency shelter, what we had, our infrastructure before all of this were 4 agencies that offered a pad-style model of emergency shelter to several hundred people a night. So this is the large majority of people who are in emergency shelter. So in this model, houses of worship host shelter sites So it's different churches on different nights of the week providing emergency shelter. And Journeys is the largest provider of emergency shelter in the north suburbs. So Beth will speak more to the PADS model and their important work to serve people experiencing homelessness before and now during the pandemic. Because the majority of people in emergency shelter across the county were reliant on this PADS model, this is in the north suburbs as well as the west and south suburbs, as a system, we had to make an immediate pivot in response to COVID-19 and the public health guidelines to ensure the safety of our clients, volunteers, and staff. And so what this meant across the county was moving a large majority of shelter guests into hotel rooms. So our data from when the shelter-in-place order went into effect in March through the end of May shows that we've served nearly 900 individuals and provided more than 42,000 nights of shelter. And about 95% of these individuals, a very large majority, were provided shelter in hotel rooms, which is by far not the norm for how we provide emergency shelter. The small remainder were served in congregate shelters that have adapted to meet CDC guidelines. So of all of these individuals in hotels, nearly half of them have a recorded disability. Over a quarter of them are 55 or older, and 1 in 10 households in hotels as emergency shelter are families with minor children. So as a planning body, as a COC, our response has been to coordinate and submit collective funding applications. We convene regular meetings between the county and the state and the homeless service providers who are providing these direct services. We have adapted some system-wide processes for how we house individuals with our available housing resources. And then we also are creating and sharing reports using data from our homeless management information system. So like those system-wide numbers that I just shared. So now the big question, since we are housing this massive amount of this huge population in emergency shelters, is where do we go from here? So we know that we're serving a record number of people in emergency shelter. And we also know that hotels are not a home and they're not a permanent solution, and they are a very costly Band-Aid. So with new federal, state, and local resources through the CARES Act, we do have the opportunity as a community to truly end the experience of homelessness for a record number of people, and to ensure that those who are currently in hotels do not have to go back to shelter or back to being unsheltered on the streets. So through the CARES Act, there are new funds that can be used for rental assistance and supportive services specifically targeted towards people who are experiencing homelessness. We know that these new funds will be available to us, but we also know that we need more landlord engagement and to come together as a community to be able to utilize these funds and to house our most vulnerable neighbors. And currently, we know that there are eviction and foreclosure moratoriums across the nation and some even stronger protections in our county. But we also know that once these moratoriums are lifted, there's going to be a tremendous surge of people who are at risk of losing their housing due to the economic impacts of COVID-19. It's hard to even estimate how big this surge will be. We do have state and federal funds that can be used to keep people in their housing as homeless prevention. But again, we also know that it needs to be a community effort for landlords and tenants to work out payment plans and to take additional steps to mitigate conflict before evictions happen. Because this is a whole new population who's been impacted by COVID, who could become at risk of housing instability and homelessness. So in general, we know that this is a healthcare crisis, but we know that housing is healthcare, and we know that a home is the best protection against COVID-19. And our goal going forward is always our goal, but especially now, is to ensure that everyone has a good, stable home, a place where they can actually shelter in place. And we know that once everyone has a good, stable home, it will protect us all. So thank you for this opportunity to be here today, and happy to answer questions at the end during our discussion.
Katie, thank you so much. That was a fantastic introduction. We're so happy to have you here today, and thank you for sharing. And without further ado, next up we have Beth Nabors from Journeys, The Road Home. Thank you so much for being with us today, Beth.
Thanks for having me, Commissioner. This is a wonderful opportunity to talk about our agency and what we do and how we've responded to the COVID pandemic. Journeys to the Road Home is a community initiative. It started over 30 years ago. I've been with the agency as the executive director going on 21 years this July. And it is definitely homegrown as far as the service provision. So what we provide to the community is, Katie alluded to all of that when she talked. We provide shelter services in partnership with faith-based locations. Our area to serve, we're charged to take care of our neighbors in the northwest suburbs of Cook County. So we operate a very large footprint. We go all the way up to the lake, to Lake County, to McHenry County, and all the way through to DuPage County and everything in between. So we have a large network of shelter providers that partner with us through the faith community, as I alluded to. We operate all year round, outside of COVID, obviously. And then we also have a Hope Center, and the Hope Center is a day program where we have master level clinicians. We provide free counseling, case management. We have meals on site, food pantry, transportation program, clothing closet. We do a plethora of things, in a group format, in an individual format. We pretty much do everything you can think of that somebody needs to have done to stabilize their lives. We work with the Alliance. We work with the Alliance to End Homelessness very closely. We're a member of that organization, Continuum of Care. And then the other part of our organization is a housing component. We partner with a nonprofit housing agency called Pathway Development Institute that only takes the Journeys client base because it's local and they want to serve their neighbors. So we have both of those buildings completely filled with once homeless individuals, 16 people at full capacity. And so we utilize that as well. When we did enter into COVID on March 23rd, we went right into the model Katie talked about, went straight into closing down our shelters and moving everybody into hotels. So between March 23rd and May 22nd, we've had 70 hotel rooms housing 121 people. We've between that time frame, we've paid out about $172,000, provided 18,000 meals. That breaks down to about 300 meals a day. And so we've been keeping everybody healthy, which we've been very blessed through a partnership with Heartland Health Alliance out of Chicago. They provide nursing and psychiatric care. They've done testing on all of our individuals in the hotels. And knock on wood, we are remaining healthy as a clinical team, as a Journeys family, and for those we serve. So we've been really blessed in that, that arena. So we are hoping that the things that we have been able to do for the community is stabilizing them. We're looking every day to figure out a reentry plan based on obviously CDC guidelines and Cook County Department of Health of how we are going to slowly integrate back into some type of system, nothing we've seen before, of course. But we are being flexible and creative as we move forward in keeping our neighbors safe and healthy with that end focus of having a permanent place to call home.
Apologize, I was muted. That's incredible. Thank you so much, Beth. We really appreciate having you here. And last but certainly not least, I'm going to introduce my next panelist. For those of you who are watching the live stream, if you have any questions, concerns, comments, please put those through in the comment section. We'll see them come through live and we'll address them when we get to our discussion. But without further ado, we've got Sonia Ivanov from Northwest Compass. Thank you so much for being here with us today, Sonia.
Thank you, Commissioner. That's a great opportunity, and I really have to thank you for bringing this conversation to the front line and hosting this like a live event, because it's like now it's even more important to talk about housing. As Katie said, it's like a housing is health, and now it's like it's even more evident. Before I even start talking about our agency, I will say that it's like, as you know, it's a very difficult time for everyone, but it's especially difficult time for people that experience homelessness and housing insecurity. because it's like it's hard enough to be trapped and not able to work or worry about health and income and everything that's going on. It's even more difficult and almost impossible to think about. It's like where you're gonna stay next, especially whenever so many places are closed and people cannot even like be there, and whenever so many people are experiencing housing insecurity. Thankfully, I mean, it's kind of, we live in a very affluential area with the support of the community and so forth, but there is a big number of people that experience so-called rent burden. They pay more than 30% of their gross income gross income, I rather say, towards rent, which means that any minor like a financial instability kind of put them in danger of losing their housing. And there is a lot of homeless individuals that are almost invisible. It's like you can see them here and there, but it's not like in a place, it's in a city and so forth. Northwest Campus is like we are like we have been in business for more than 30 years. We also serve like a huge geographical area from the Lake to Cook County portion of Elgin, all the surrounding municipality, townships, and a community. And the easiest way for me to explain what we do is that our services are based on kind of three major categories, like a stabilization, empowerment, and housing. The stabilization is something like a solution-focused case management in-house food pantry, including like a meat and eggs and vegetables and so forth, connection to stream and linkage to mainstream benefits, coding closet, I mean, it's kind of transportation or support and so forth. The empowerment services are more about like a career coaching and job readiness and money management and legal assistance and life skills, nutrition and so forth. And housing probably is the biggest portion of everything that we do. Katie already mentioned that it's like in order to really effectively use all the funding and resources for housing, it's like the government coordinated the resources, and we became the lead agency in the North for initiative called Coordinated Entry, which basically is like coordinate services and housing options for people that are homeless or unstably housed. We do have a transitional living and permanent supportive housing program that we serve people that have been in a verge of homelessness or homeless. We have a youth program, street outreach, and a variety of like a housing counseling, prevention, homelessness diversion, rapid rehousing, and so forth. Whenever the pandemic started, I mean, kind of that was like a mid-March, we met with staff and we decided that the essential service and we cannot keep our door closed. And since the beginning, we never ever close our doors, and all my staff have been at work the entire time. Because now, unfortunately, we are needed more than ever. Obviously, we change some of our processes, procedures, and it's like we use all the precaution and so forth. But then we have influx of new clients that are coming to obtain food or talk about like their housing. Yesterday only, we put like a 2 household in a motel. One of them is coming from a hospital and the other one was coming from a treatment facility. There is a lot of people that were doubling up because of the rent issues, and now they cannot stay in a small places, especially whenever somebody tests positive and it's like they're losing their housing. There is a lot of people that are really, really worried how they're going to pay their next month mortgage or rent. And as Katie said, even though there is a moratorium, people are aware that sooner or later will be lifted and the consequences will be even dire, especially now whenever we know that more than 44 million people are without employment and income, and they may not ever be able to get back to their jobs or find a new one. It's really a huge concern in our community. It's like how we're going to sustain. Thankfully, there is some help that it's coming and additional services and support and so forth that will be available for anybody that is experiencing some kind of housing insecurity or homelessness. But truly, every one of us know that will be a tough road ahead, and it's like and our services are really needed. And the last thing that I want to say, it's like first of all, it's like thanks the commissioner that he participated in our team during the last point in time count, and it's like you can see it's like how people are sleeping in their cars, or they're just moving from place to place and have no place to stay for various reasons. And I have to say, nobody gets in the morning thinking about, I want to be homeless tonight and wondering what I'm gonna stay or what I'm gonna do. But it's happened, life's happened, and that crisis probably it's like it's a silver lining for all of us as a society to think about like not just the effect of homelessness, but to think about the costs of the homelessness and really try to find a solution why this is happening. I mean, it's kind of obviously mental health and substance abuse and lack of affordable housing and lack of opportunity and so forth. And all those things, it's like now more than ever, it's like are on the front line, and we can try to find a solution and work together to resolve it. And I really thank the commissioner for hosting this event and trying to like give a voice to all of us and help the community to know more about it.
Of course. No, thank you so very much, Sonia, and to all of our panelists. Thank you for the incredible work that you three are doing to help make sure that we're moving in a better direction as a society. I just want to do a quick reminder to everyone who's watching us live right now. If you have any questions, concerns, comments, please put those in the live stream comment box, and we'll be able to get through those. We're about to start our discussion section. I recognize, and I've been working with the county to ensure that we are creating programs and policies that help individuals during such a drastic time in our history, especially when it comes to dealing with a healthcare crisis and the economic ripples that we see today. I've been pushing this as I speak to my fellow commissioners and to the president's office that, you know, when the courts do reopen, it is incredibly critical we do whatever we can to ensure individuals are able to make their rent and able to make their mortgage payments. Because if our local governments do not stand up to ensure people are able to remain in their homes, we're going to see the economic effects of this moment in time for years and years to come. And I really feel that allowing that wound to open is going to be far worse than if we take action now. And so that's something that I am currently advocating for, and I want you three to know that. Without further ado, it is currently Pride Month. Last week we did a conversation on Pride, but it also has a lot of link to being unstably housed as well as being homeless. And so my first question that I would like to ask our panelists, and I'm going to start first with that. I apologize. I'm going to start first with Katie. But LGBTQ teens are at a much greater risk of experiencing homelessness than their non-LGBTQ friends and classmates. One study has said that as many as 40% of teens who are experiencing homelessness identify as LGBTQ. Can you talk a little bit about what you know and what resources you have for teens who identify as LGBTQ? Do you partner as well with LGBTQ organizations? And we'll start with Katie.
Yeah, thank you so much for lifting this, because I think this is such an important intersection of both LGBTQ status, of race, and of disproportionate experience of homelessness. So to add to the statistic that you gave, the Chapin Hall at the University of Chicago did a great study in 2018 that really dove into the factors that drive youth homelessness and found that 1 in 4 LGBTQ men who are Black, who are between 18 and 25, reported experiencing homelessness in the past year. That's a quarter of Black men 18 to 25 who identify as LGBTQ experiencing homelessness, which is massive, right? We also know that about a third of transgender adults have experienced homelessness at some point in their lives. And then we also know that over 80,000 LGBTQ youth are homeless for at least 1 week each year. So this is massive and hard to ignore the intersectionality there. So we have some exciting new youth projects starting, and I'll let Sonia speak to that a little bit more. But one of our core values in serving young people is to affirm their gender identity, their sexual orientation, and to provide the appropriate services to them, not only providing them with housing, but serving them as whole people and including them in the decision-making about their care and their housing. So thank you for raising this issue. I think it's incredibly important. But
Of course, and thank you for sharing even more information. It shows how much work is left to be done as we continue advocating to a complete end of homelessness moving forward. But you called out Sonia, so this
You called me.
I would love to hear you speak more on this topic.
Yes, thank you for asking. June is a Pride Month, as you know, and I can see the flag behind you, Commissioner. And it's like a perfect opportunity to talk about it. It's like the project that Katie mentioned about it. It's something that we are extremely excited and very proud about it. It's like it's called the Youth Demonstration Housing Project, and started probably more than a year ago due to the fact that it's like we, the Alliance to End Homelessness, the providers in the Alliance to End Homelessness, I rather say, were invited to be part of a 100-day challenge to end youth homelessness on a national level. And there were 5 communities across the nation that participated in that challenge. And it's like proud to say it's like we did so well on the challenge, and we exceeded our goals at the time, and we were invited to apply for this like a youth housing demonstration project, and we were one of the largest community awarded the grant. We were the 3rd one, right, Katie? The 3rd largest award.
yeah.
Based on that, it's like we as a community in Cook County receive like more than $6 million to address and combat youth homelessness. And then it's like all the providers had an opportunity to apply for their own project. And that what just recently happened. It's like and last week the project were obviously it's like reviewed and selected, and thankfully and proudly I can say that our agency partnering with Kenneth Young Center, it's like was one of the projects selected in the Northwest region, and we'll start in October 2020. We're gonna have like more than 24 units that provide like a housing and supportive services to youth 18 to 24. And as Katie said, it's like a 40% and even probably more of youth that experience homelessness are like LGBTQ plus. And I'm very happy that we partner with Kenneth Young Center, because it's like they have a very extensive experience and history working with LGBTQ plus youth. A year ago, they opened their LGBTQ plus that it's like geared towards services, and it definitely it's like we want to expand our services to anyone, but especially to a group that is so marginalized. And I want to say it's like a couple of years ago we started our own youth program, because it's like we saw the need, and I'll never forget. It's like the first 5 youth clients that we saw, 3 of them were LGBTQ, which is right there. It's like shows the numbers that it's like they're the one that usually very quickly in a very early age, it's like become very unstable.
Incredible. Thank you so much for sharing that. And I know I congratulated you when you got the grant, but
thank you.
Congratulations again. Very well deserved. And
thank you.
Make a huge difference here in the Northwest suburbs.
Yeah, we are very excited and cannot wait to start.
It's so exciting. No, I appreciate it. And Beth, if you could help share some of the LGBTQ resources.
Sure. The thing that happens at Journeys is a lot of times when you don't have strong initiatives like Katie and Sonia had alluded to, What happens is it ends up being an adult issue, that the lack of feeling included, lack of feeling equity, going their entire life of not being able to be open with who I am, all is perpetuating these feelings and this inability to step forward and progress through stability in life. So we couldn't be more excited than to see this type of initiative come into the community, because what we'll see is we'll see less pain people coming to Journeys. And that's super important to us. I think that that is probably the impotence of why the community needs to know this initiative is important. Why do individuals who are from the LGBTQ community have that linked with homelessness? Why is that? Why is that one of the reasons why somebody leaves home and the streets is more comfortable for them than the safety of their home? Those are the things that are so important for any agency to dig deep into and really get into the psychology behind the problem, so that we can have inclusion, so that it's not just equality, because equality is not necessarily the actual word, it's equity, because everybody has to start at the same place of the race, right? When everybody's coming up to that starting point, you have to make sure everybody has the same resources possible to have a chance at winning it. And that is why this initiative is so important. And Journeys is going to be the beneficiary of it, because the people who come to our organization are going to have the benefit of possibly having contact with this grant, everybody who's working within that grant. And then we'll be able to come from a starting place that is further along than where we would have been without it. So we do definitely celebrate these initiatives. We think it's great. What happens at Journeys is we address things with policy a lot, making sure that there is a method for an individual who is in the LGBTQ community to voice something that does not feel inclusionary, something that does not feel right. That's very important to Journeys. We make sure that everybody has a chain of command to address anything they need to address. We have specific policies about bathroom use, sleeping quarters, things that are incredibly important to make sure anybody who is struggling with homelessness doesn't have all the extras to deal with too. We want to just unpeel your housing instability. And then while we're doing that, hit all the other life domains, because I think that's super important. So we come from a very clinical based process at Journeys. We wrap services around people. We come from a very holistic approach. Our case managers are all at master's level. They're all licensed. Our clinical director has been with us for 17 years. Our mental health therapist has been with us for 16. And again, I've been with the agency for 21. So that consistency and longevity really gets us to know the population, probably better than most. And we do know our area very well. So we are excited that this is being unpeeled. We're excited that it's coming to our community. And I think it's just going to strengthen us all.
That's incredible. No, I really appreciate you sharing that. And that is an incredibly important point. What are the issues and the systematic homophobia that plague households that cause LGBTQ youth to end up not feeling safe in their own homes with their families? And so thank God we live in a state that now has implemented that LGBTQ history will be taught in schools.
Yes.
I wish that had been the case when I went to school. I didn't know any of my history until I went to college. But no, that's an important topic. And just going back on to what Sonia said, I don't think I've done a town hall. I know there's an aside, but I think every one of these Zoom town halls we've done, we've had a mention of Kenneth Young Center and their advocacy and their programs that they provide in the Northwest suburbs. So go Kenneth Young Center. And
they're rock stars.
They are. They helped me when I was a youth and I was dealing with bullying. So I'm grateful for them as well. But I just want to give a shout out to anyone watching this live. If you have any questions, concerns for the panelists, for me, any of that, please put it in the comments. We will address it. We're in the discussion portion of our conversation now. So anything you want to do from the topic of how to end homelessness, how to get involved, where to reach out, please put your questions in the comment stream. Our first question that I'm going to bring up now is from Patricia Watson, and thank you so much for bringing this important question. And I'm curious for our panelists, what have you heard on this topic? Her question is, bring back transitional housing programs for throwaway teens and pushed out young adults. There are young people couch surfing because they have no safe place to call home. So what has it been like in terms of seeing an increase in transitional housing programs to get people on their feet and get stably housed? What have you been hearing from local leaders, and what can we do to help better this circumstance? I'm going to start with Sonia this time.
The project that I just mentioned, I mean, it's kind of, we have a different transitional living program. And at this point in time, it's like we had 3 households that are youth 18 to 24 in this program. 2 of them, one is a single mom with 3 children. We have a household of 1 couple with 2 children. And we have another couple that the girlfriend is pregnant. And transitional housing is extremely important because it's like in a lot of cases, it's like timely support is the most important thing. It's like Beth already mentioned, it's like whenever you don't address an issue, youth homelessness, for example, it's like that lead to the life changing circumstances for a very, very long period of time. And it's much more difficult to kind of solve it later on. But whenever you have some stability and support and social emotional connections, and it's like and also some guidance through the process, together with housing options, it's like they really for a very short period of time can become very productive member of society, very self-independent, and actualize their potential in so many ways. With the new project that we just talked about it, it's like there is a portion of the housing project that will be exactly transitional living program. It's like it will be for youth that may couch surf, may just about like a kick out of home, run away. It's like a homeless for a period of time and so forth. But will be a bridge, immediate housing, almost like a crisis housing intervention that will be youth will be able to access immediately, and then they will have another option to kind of move on their own and rent apartment on their own, but we can provide like additional assistance, not only with supportive services, but also with portion of paying their rent for a period of time, and slowly like start paying like 100% of their rent to 75, 50 to 25, and help them budget their income and money a little better, like learn skills and so forth. And whenever they're ready to become completely and totally independent, they will have, it's like it's their own choice. But will be different type of housing options that the youth may choose from the get-go entering the system. And this transition period, it's like will be client-centered and really driven by their choice.
No, fantastic. Thank you so much for sharing that, Sonia. I really appreciate it. Next, I'm going to send the question over to Beth. If you could discuss some of the transitional resources and programming that you have available at Journeys.
Well, we're lucky to be part of a process called Coordinated Entry, and through that process, and that's run through the Alliance to End Homelessness as well, and you'll get to notice through these discussions how we're all so linked together. You know, it goes from coordination to then filtering down to the organizations. We all take a little piece of the pie. As far as housing goes, I think the thing that's so important is that there is a menu of options, like Sonia alluded to. I think that Patricia's right. Transitional housing is super important, and there needs to be that option for all different types of population, not just the forgotten youth and the ones that are pushed out, but for every aspect of homelessness and who experiences that. You know, I think there needs to be all different options: scattered site housing, affordable complexes, the same eclecticness and diversity that our population alludes us to make these creative programs that are just as eclectic and diverse. You know, cookie cutter doesn't work. I worked many years in the substance abuse field as a therapist prior to going into what I've done for the last 21 years. And I have to tell you, a 30-day cookie cutter program doesn't work for everybody. And not everybody needs AA. It is super important to individualize every single exchange you have with an individual. And we always start from appealing the impotence of homelessness and what did get you into this situation. Then we make really deliberate decisions about what kind of housing is most important for them. Is this person resilient enough to go into a coordinated entry and maybe be placed out of the community they're comfortable with? If they are resilient enough and they're capable of doing that with success, that's the route we go. If we have somebody who has some real trauma and is linked into a local community for various reasons, you know, then we take a different approach. But that is the thing that we do with Journeys. We're all about coordination. We really want to strengthen all of our partnerships, but sometimes there's a unique approach that is not as cookie cutter, needs to be grabbed out and done in a different way. So I think that that's what's really important, Patricia, when we're talking about housing. It's just not one approach for everybody. It's got to be unique.
That's fantastic. No, I appreciate that. And Katie, do you have anything you would like to add to the conversation on transitioning?
Yeah, I can. Sonia spoke to this, but across the county, like she mentioned, Suburban Cook County was awarded a youth homelessness demonstration program grant, which one part of the reason we were awarded that is because we have a huge need for transitional housing for young people. We don't have enough dedicated services for youth and young adults, and we define that as anyone who is 24 years old or younger, and so. Sonia was awarded the program in the north for this transitional housing, rapid rehousing, joint housing project, which, like she said, is very client-centric, provides that immediate crisis housing for young people, and then this progressive engagement into what does it look like to maintain your housing on your own with rental assistance and supportive services. But we also have new programs starting in the west and the south suburbs, which is very exciting, so that young people, no matter where they're at in the county, can have immediate access to a transitional housing program, so that they do not have to be homeless, and that we can immediately meet the needs of any young person who needs a safe place to stay.
That's fantastic. I appreciate that, Katie. Now, with our next question, first, I do want to give a shout out to everyone who's watching live. If you have any questions for our incredible panel, any questions, comments, concerns, anything you want to hear answered on today's live stream, put them into the live comments and we'll make sure to get to them. And I think I just saw one come through. I just wonder if there is an inordinate emphasis, certainly necessary for some, on treating homelessness and housing. I'm sorry. You know what? I'm going to let my team clarify this question. I'm going to go to another one first. But what are, if people are as passionate as I am in helping end homelessness and see the end of those who are unstably housed, the next question is, what are some ways that neighbors wanting to support organizations like yours can get involved? I'm going to take a quick guess and just assume Alliance Homelessness, Northwest Compass, Journeys. I bet you they all have a contribution link on their websites. So make sure and go and give support to these three incredible organizations. They're doing a lot of good for our neighborhoods. And also, I want to throw it around the horn. Give a shout out to your websites, your social media, ways people can get involved, be it volunteer or even making, say, food donations or clothing donations. I'm sure that there are needs like that as well. We'll start with Katie.
Yeah, so thank you for that. I absolutely say donate to your local organizations who are doing this really difficult work day in and day out. Our organization's on the screen there. We link to all of our provider agencies on our website, their donation pages, that also shows needs in terms of in-kind. Do they need volunteers? Do they need food? Do they need clothes? All of them need money. So donate is a huge thing that you can do. I mentioned this earlier, but this tremendous need now for more housing will require these new funds, but also will require engagement from landlords. So if you or someone you know is a landlord, I also ask that you partner with your local homeless services providers. This will make sure that, one, the agency can provide those supportive services and rent assistance, but also this is a really great way to fill vacant units and to truly end someone's experience of homelessness. So our local providers are excellent partners and are always in need of more landlords who they can work with to, like I said, truly end someone's experience of homelessness and provide them a safe and stable place to live. Another thing that you can do is you can ask your city council about their affordable housing plan. Most cities are required to participate in the Affordable Housing Planning and Appeals Act, which means that they have to be intentional about what does it look like in your community to create affordable housing. push that. A key way to ending homelessness is to make sure that people can stay in their homes, and there are homes that people can afford. So that is huge need. And then just in general, as we anticipate some pretty huge state revenue deficits because of the economic impacts of COVID, asking that you advocate to your state reps that they don't cut homelessness and housing budgets. Totally understand the constraints that we're under right now, but now is not the time to defund the homelessness and housing system. Yeah.
No, I think that's incredibly important. And I'll just shout out, hey, hit up your county commissioners too.
Yeah.
I'm working on these efforts, but we've got 16 other commissioners who could use a call or an email.
Absolutely.
No, that's amazing. And Sonia, I'm going to go to you next.
Katie said it so beautifully that I don't know what to say, what more to say. The thing is kind of, we live in such a supportive and giving and generous community that every time whenever I have to ask for more, I'm like, oh my God, I should stop. But then on the other hand, it's like we really need the help of each and everyone. It's like from volunteers to people that it's like have or just want to help with food pantry, or skill volunteers, to people that advocate and continue raising awareness of the issues, to people that really work as our ambassadors, spreading the word, and of course money, of course. And the reason for this is in maybe not so many people know about it, but each and every federal state funding that we get, it's including even private funding, it's they are asking about what your agency budget for the program, or what is so-called matching fund, which means that it's if you get whatever amount of money through any of the sources, they want to make sure that the agency has those matching funds, and they vary from 10 to 25% to 100%. And sometimes it's an agency cannot even apply for additional funding available on a higher level because they cannot secure the matching funds. And that's why the community help is extremely important. Again, we are grateful to any type of help and assistance that we can get. And it's I know it's a difficult time for everyone, but no matter how small your gift could be, will really make a difference and will change lives.
Oh, that's amazing. And Beth, do you have anything to add? For one, I love how the Alliance on Homelessness has all of its partner organizations. Oh, yeah. Everyone needs a little help. Throw money all around. But Beth, anything that was missing? Anything you want to shout out?
I just want to agree. I want to agree that the Alliance on Homelessness, I wish every industry had a coordinating body. But it's just not everybody has that luxury. But Katie has the plethora of information because we all feed into her, and so that's and that's a wonderful place to sit because you get a real big viewpoint. The only thing I could add to that is obviously everybody said what they needed to say, but the thing that's super important is to get involved with your community. Okay, that's the biggest thing you can do. Whatever your area of interest is, wherever you feel that the most vulnerable population could utilize your strength, whether it is time, talent, or treasure, we all could utilize you. And anything you do for your most vulnerable only makes the community stronger. So you have to realize that by defining the problem, it doesn't all of a sudden bring the problem to you. It's here. So let's define it. Let's put our arms linked together, and let's do what we need to do to end homelessness. If you want to find out more about Journeys, we're at www.journeystheroadhome.org. We're on all social media platforms, LinkedIn, Facebook, the whole gamut. Jump in, become a Journeys family member. You won't regret it.
Oh, that's incredible. I greatly appreciate you sharing that. The next, also, anyone watching live, you have questions, concerns, comments, throw them into the comment stream. We'll be able to see them and get them addressed. Anyone who watches this recording, if you have questions for any of our panelists, put those in the comment stream or send us a private message. We'll make sure to get you some answers as well. Our next question is talking about one of the contributing factors for people who become either homeless or unstably housed, which is the overall discriminatory practices of renters or sellers when it comes to housing for based on racial or say multi-ethnic families, or say if individuals have a mental health issue. If anyone wants to talk about the work to address that issue as it pertains to how individuals end up potentially becoming unstably housed. And this time I'll start with Beth.
Well, people become unstably housed for so many different reasons. When we're talking about cultural issues and race issues, that has to be addressed at the core root, and we have to be vocal, and we have to address any kind of discriminatory practice as an agency, as a community, as a resident. We're in a time right now where the world has said enough is enough, and I think that is outstanding. I hope we can do it in peaceful ways, and I think it's really important for all of us to stand together and just deal with the inequity that the world has allowed us to live within for too long. And I think that is just hugely the impetus behind all of this. But as far as mental health and physical situations, it's about partnerships. Journeys knows who we are and what we can do, and the things that we can't do, we partner with really good people who can. So we're very lucky to have Heartland Health Outreach Alliance, who has been providing over a decade of medical care and psychiatric care on site for our population free of charge. We're very blessed to have Northwest Community Hospital partner with us for prescription drug programs. So everything Heartland Health Outreach prescribes, Northwest Community Hospital fills. So we are very, very lucky. Way before the initiatives of health and housing coming together, Journeys has been doing that because, again, we have a guy named Todd Stoll, who's our clinical director, who's been around for 17 years, and he's been ahead of the game with a lot of our program designs. So that's important. You have to rip down the domains of everybody's life and attract every area that needs stability. Go after it.
No, I appreciate that. And how about Sonia? Do you have anything you would like to add?
I agree with Beth that it's like all the domains in the human life needs to be addressed. Otherwise, it's like there will be always be a problem. And I don't want to repeat like what you always said, which makes it's like it's enough is enough, and it's like we all have to try to be inclusive and work for a just work and so forth. But I want to mention also that a lot of the problems like kind of stem out from some kind of personal or economic instability and a lack of support. Because I mean, it's kind of all of us are going through tough time from time to time. It's like that's just human nature. But it's like you have enough resilience or enough support or enough money to kind of overcome it. And there is a lot of people that lack those type of systems and support. And it's like, and that's why the society, and it's like the society, we have to work together in order to really help the one in need, because it affects everyone. It's like we discussed this 1,000 times. Homelessness is not free. It's like it affects like each and every level of the society. A homeless person goes through the emergency room to healthcare, to juvenile system, to the court system. It's like to social service agency and so forth. And it's much easier to house someone for between like $20,000 and $40,000 a year and support them to be independent and rely on themselves, instead of like moving them from place to place and paying for so many different entities. I mean, it's kind of, now I'm thinking, it's like it's so wonderful that people, the community got together and there were enough financial support to put people in hotels. What's going to happen a month from now? It's like you re-traumatize them a big time, because it's like suddenly 3 months later they're again on the street. Instead of, we really have to work on affordable housing, that it's like Katie said, and as a community, it's like we have to find solution, not just for, we just have to find the cause of the problem, which is affordability and lack of like a personal economic stability and inequality, and try to work it and really find a solution. It won't be easy for sure, but at least it's like, I think that more and more people agree that unity is.
No, I agree.
Help.
100%. No, that I agree 100%. And, you know, I just want to shout out to our audience. If anyone feels that they've been denied housing in a discriminatory fashion, chances are what that renter or landlord did was illegal. So please reach out to my office, reach out to any of these organizations on the line. If we can't get you the direct assistance, I bet you we know a partner who can, to make sure that we right that wrong. But it's important. And there are so many statutes in place that target discrimination based on gender, ethnicity, disability, and the like. There are a lot of protections out there. So reach out for those answers if you feel like you've been discriminated against. I'm going to next go to Katie when it comes to this, but I do want to throw in, you know, the Alliance to End Homelessness and all these organizations fought so hard last year to pass fair housing in Cook County. I was so proud to be a co-sponsor of that initiative. and that is helping individuals who have previous felony records be able to rent and not have to continue with that burden and end up into the homeless population. So that was a big fight that we pushed for justice on last year. But when it comes to discriminatory practices, when it comes to housing based on race or mental or disability, Katie, what are your thoughts?
Yeah. So thank you for that. I just want to name too that homelessness is a racial equity issue. That racial disparities make homelessness way more prevalent for people of color. This is absolutely tied to systemic racism, which accounts for lower levels of household wealth. We've seen this within COVID-19, higher risk for coronavirus within communities of color, other disparities, exactly like you talked about with the Just Housing Initiative, much higher rates of incarceration. And so I know we as an organization are thinking about this, but like, what do we do to be intentionally anti-racist in our programs, and how we fund programs and how we administer programs is vitally important, because we know that we are homelessness is rooted in systemic racism, and we need to be able to address those inequities to truly end homelessness, which is in our name and in our vision. And then another very concrete way that you talked about, and I'm grateful for your leadership on this, but the Just Housing Initiative that you mentioned is specifically focused on ensuring people who have an arrest record, conviction record, are not denied housing based on that. And we know that disproportionately impacts people of color because they are incarcerated and arrested at much higher rates. So really grateful for all of the partnerships coming together for the Just Housing Coalition that worked tirelessly for many, many years to get this passed, that now in Cook County we have set practices in place that landlords cannot deny housing to people based on a previous conviction history, which we know now within COVID that was implemented January 1st, and we know that there's obviously a lot of extenuating circumstances, so we don't know the success of that yet, but I am confident that will mean less people experiencing homelessness because they have more access to housing.
Of course. And now, just to be respectful of time, I have one last question that I'm going to allow Beth to answer, just out of curiosity, since you are running and working with Journeys. I'm just curious, in the wake of COVID, with what we're learning about these very contagious illnesses, what are the lessons learned for your shelter, and what are the changes you think will be long lasting due to COVID and how you operate?
Sure. Lessons learned, operating with more flexibility and creativity. Looking for the positive in all of this, which is very hard. But what we are trying to do is the resiliency of trying to lead by example, teach our clients that we can persevere through tough times, and be solution-based problem solvers. But how we plan to reopen, what it looks like, we're working on that plan right now. But I think it's going to be something we've never seen before. For our clients, I think we're going to be slowly transitioning them out of the hotel, slowly into some shelters over time at greatly reduced numbers, slowly building those numbers in the shelter based on the CDC and CCPH's recommendations. And then with the volunteers, same thing, slowly transitioning them in 40 and under group first, moving ourselves into some of the older volunteers once CDC and Cook County Public Health allows. And then for our day center, we're going apartments by appointments only. We'll increase the number of people we'll see at any given time. And then we're going to zone out the areas. So we're going to have zoned areas throughout our entire building of higher risk areas to lower risk areas. But the plan's underway. We're preparing, we're getting the staff ready far before the order comes that we can start bringing back people into the shelter system.
Incredible. And I just want to, again, thank everyone who watched live. If any questions were left unanswered, we'll make sure to get you those answers in the near term. Anyone who watches this recording, if you have any questions for me or our panelists, put those in the comments, send us a private message, send us an email. We'll get you an answer and make sure that you're able to participate and get the resources you need. But we're about to see the turn of the hour, so I'm going to go one last time around the horn for some final comments. This panel has been incredible. Thank you three so much for joining in on this conversation. Thank you for the work that you do day in and day out. You're making incredible change for our county, for our community, and I am very happy to be in the fight, partnering with you three. But we'll start first. Let's go with Beth, then Sonia and Katie. Beth, any final words?
Well, I just want to thank you very much. I think that it's very hard to get these topics out into the forefront. It's not comfortable for communities to look at their blemishes and their difficulties and their challenges. And it's hard for affluent areas, specifically like the northwest suburbs of Cook County, to realize that the challenge is here. So thank you. Thank you so much. And I think that it takes an army. And so we're willing to join our little fighters and start moving forward. So thanks a bunch.
Thank you so much for all you do. So happy to have you here today. Sonia.
Thank you for having me. Thank you for leading this conversation and you shipping a topic in general. It's like I have to say something which is kind of banal, but it's like we all in this together and we really can make a difference. It's like no matter how small, we all can do a better job. And I have to thank our community for being so generous and kind and giving, and I know that we can do better. And it's like and will happen. We'll end homelessness together.
Amen. We'll win this fight together. I'm here to fight with you. And Katie, any last words?
Yeah, absolutely. Just lifting up what both Beth and Sonia said, but thank you for elevating this professionally, personally, as a constituent of yours. I am just very grateful for your leadership on this. And yeah, we all do better when we all do better. So I'm looking forward to continuing this fight and using these new resources to truly end the experience of homelessness for a record number of people. I think it's within our power and it's necessary and we can do it.
No, I couldn't agree with you more. It has been an honor over the past year and a half to work with these three organizations. Thank you three for your leadership. Thank you for joining this important panel. And I hope everyone enjoyed this conversation. I tell you, I've taken part in the point in time count these past 2 years. There are individuals experiencing unstable housing and homelessness right here in the northwest suburbs, from our richest to our middle of the road economic communities out here in the northwest suburbs. It is all around, and we have to do a better job in helping end homelessness once and for all. I look forward to helping be part of that fight moving forward. Northwest Compass, Alliance to End Homelessness, Journeys, these are three incredible organizations doing a lot of great work for the northwest suburbs. I hope you will help them ensure that they continue to have a strong voice in the fight ahead. Thank you to everyone, and I hope everyone out there is staying safe and healthy and enjoys this weekend.
Thank you.
Right, thank you.
Bye-bye.
Take care.
Someone on my team needs to end the live stream.
We just like hanging out with each other.
Yeah.
We're just like, what are we gonna say?